Welcome to Invisibly Unwell. I'm your host, Paige Lavelle. I've spent the past 2 decades climbing the corporate ladder. I've worked hard to get where I am professionally, but there's a side of me that few are aware of. I am also an autoimmune warrior, an eating disorder survivor, an author, and now a podcast host. My goal here is to educate and empower high-achieving women navigating autoimmune conditions and other chronic illnesses, who at the same time are also dealing with challenges that all high-achieving women face, like disordered eating, perfectionism, and people-pleasing. Invisibly Unwell is what I wish I had at the start of my journey. You are not alone. I hope my story and the stories and expertise of my guests will provide you with knowledge and ideas and empower you to share your own story and advocate for the life you've worked so hard to build. Quick disclaimer, this podcast is meant for general information purposes only and should not be taken as a substitute for medical advice, diagnosis, or treatment. Today's guest is Dr. Saimun Singla, a triple board certified physician in general pediatrics, pediatric rheumatology, and integrative medicine. Through her own journey with rheumatoid arthritis, a diagnosis she did not receive until she was actually already a rheumatologist, which I find fascinating, she's learned the power of using both Western and Eastern therapies to reach remission, control symptoms, and manage flares. Room to Grow, love the play on words, is the name of her practice, and it was created for parents who want a more holistic yet evidence-based approach to their child's chronic condition, and for adults who want to add lifestyle-focused and holistic interventions to supplement their current rheumatology care. Her story is incredible. I was first diagnosed by a pediatric rheumatologist at Texas Children's Hospital, which is where Dr. Singla trained. And I think what she's putting out there into the world for pediatric rheumatology patients is just incredibly inspiring and something I really wish was available when I was that young patient. I know you will take something of value away from this, even if this is not specific to the disease group that your condition or the condition of someone you support falls within. Quick note on this specific episode, we had a recording issue at the beginning, so it'll sound like we jump right into the conversation, but do not worry, the only thing you missed was the introductions.
My journey started, interestingly, I went into medicine. I became this pediatric rheumatologist, just the love for rheumatology, immunology, and kids. And about a year or two after becoming a full-blown pediatric rheumatologist, I myself was diagnosed with rheumatoid arthritis. And so it was a little bit of an ironic spin to everything, you could say. And I think the moment I became a patient, the entire field of rheumatology kind of changed for me. It opens your eyes to a lot of different pain points that as a provider or the doctor, you don't really appreciate. So I think coming in from the doctor side, you're like, you have these symptoms, this is the diagnosis, and this is how we're going to treat you. But then on the patient side, you start treatment and then you don't get better, or you do get better and then you flare, or you're having weird new symptoms that no one knows how to figure out. And you really try to figure out how to incorporate this new diagnosis into your life. And no one can really tell you how to do that. It's something that you learn. And so that whole journey and process kind of has opened my eyes to the world of like resources and patient support. And so I actually, after finishing and practicing rheumatology, not finishing, but practicing rheumatology for a few years, I ventured into something called integrative medicine, which is basically lifestyle medicine and how you can incorporate various lifestyle factors into somebody who has a chronic illness. And then if you're going to go and try complementary things, you need to look for the most evidence-based kind of things to try, right? In addition to the regular medications that you're on. So my role kind of changed from being this traditional rheumatologist to more of one who's more open-minded and understands the process, right, of being a patient. And kind of incorporating the best of the East and the West is what I say. And so that kind of led me to start my own practice in August of 2022. So it's been a little bit over a year and a half. And that's been a whole different learning curve. But, you know, being the patient side of things and also trying to be a high achieving person with a busy career and a mom, I have 3 kids and a husband also in medicine. It's been a lot of learning. So that was probably way more than you needed to know.
This is a very safe place for long-winded answers. I much prefer you to get into it because I feel like it's just, you know, you speaking to your passion and what brought you here. So interestingly enough, I shared this offline with you, but I received my first diagnosis initially was of Raynaud's disease as a standalone condition. And then they realized a couple of years later that it was part of limited scleroderma. But I was diagnosed by a physician at Texas Children's, specifically the rheumatology department, which I know is where you were trained. And I really appreciate you talking about looking at, I know the word is used in a lot of different ways today, but more of that holistic view of health. And I do appreciate that you called out the evidence-based approach, because it took me till I was, to be frank, in my 30s to really pause and consider that my stress level and my diet and my exercise, and I'm not, just to be very clear, I'm always very open about this on the podcast. When I say exercise, I mean what is healthy for you and sustainable and that you will stick to. So I almost want to shift it to just movement, whatever movement is good for you. But there's a lot of information out there that we get bombarded with on social media, because the wellness space has been a bit, it always started with good intentions. I think everyone that's out there in the wellness space starts with good intentions, but there are some things out there that almost border on predatory at this point. And you can see something in your Instagram feed, or even I've seen stuff on LinkedIn, to be frank, that kind of directs you to certain practices or things, and they're pitched as a fix-all without having the unique approach to your specific set of health circumstances. And so I would love it if you could speak more to how you can have an open mind and look to these more holistic approaches, whether it's a healing modality with Eastern roots. Like I've looked into Ayurvedic therapy. I've looked into acupuncture, which I still utilize, which I love. As someone who's a very type A high achiever who works too much, acupuncture is great for me. But so there's those things out there where there are studies that show the benefits of these things. I would love it if you could speak more to how to have a bit of a discerning eye when you're looking into these options that are available to you as a patient, to make sure you're looking at what's really out there and then having an educated approach to trying and determining what works for you versus latching on to something that it looks great on paper or it looks great in your Instagram feed, but there's not really anything to substantiate it. So you might be taking a risk.
That is a great question. And I think, first of all, what you said, like how to be discerning, I think that is the key. Number one, you need to be discerning. Okay. You have to take a step back. This wellness space, like you mentioned, and even the term holistic can sometimes be used in multiple different ways. You know, a lot of people think hair analysis is the way to go to diagnose something or to treat micronutrient deficiencies. And they're like, oh, we take a holistic approach. I don't agree with that. So it really, you have to take it into the context of what are my symptoms? What are my goals? What am I looking for? Because when you look at the wellness space, you're right. A lot of the stuff can be predatory because they're preying on people at the worst point in their lives. No one that's feeling great, right, or not needing help is going to be really looking into these things or doing a deep dive into these things. And so I think the biggest thing is, okay, what is my goal and what have I done so far? And what am I trying to what's the gap that I'm trying to bridge here? Am I trying to sleep better? Am I trying to feel better? Do I want my disease to be gone forever? Like, what are we addressing? Because if your question to me is, hey, can you make my disease go away forever? The answer is going to be no. In the world of autoimmunity and chronic disease, the majority of patients will have this for their life. And it's a matter of coping and being on the right medicines to keep it quiet. Okay. That is the reality from both the patient and doctor perspective. I'll tell you that. Now, how we do that, how we go about that is where the art of medicine kind of comes into play, right? So you should not be let's say not open-minded or not be closed-minded, I guess, to the fact that we have this great set of modern day medications to help put your disease at bay, right? So these are your biologics. These are your immune suppressants in the world of rheumatology. Now, I get it. I'm on it too. Nobody wants to be on these medications forever, but there is nothing out there that swaps. It's not a one-to-one swap. There's no natural one-to-one swap for an immunosuppressant, right? Let everybody know that. So in your head, when you're trying to discern, should I try turmeric versus, start methotrexate for my arthritis? Know that you're not comparing apples to apples. You're comparing two different fruits. Maybe one's a vegetable, one's an apple, really, in this scenario. So you have to realize the heavy lifter is probably going to have to be this methotrexate, but what else can help me decrease the inflammation or decrease me not feeling great, right? The whole thing is feeling good. So do your joints hurt in the morning? Whatever your symptoms are you having a rash? Are your muscles aching? What are we helping? Because sometimes traditional medicines can't help a lot of the pain parts of it because it's part of the disease process. And that's where you really need to look at more holistic or integrative stuff to figure out what is it that you need. Okay. If the biggest red flag is going to be, like you mentioned, if someone says, I have the cure for your disease and your symptoms, you need to run the other way. That is step one. Because you have to interpret everything people say in the context of what your disease is and what the reality is of your prognosis, right? So if you're on lots of steroids, there's a good chance that your bone density is not as optimal as it should be, right? So maybe, yes, you should check your vitamin D level or work on resistance training and things like that. If you have osteoarthritis, going to the pool, less impact type of sports, you have to modify a few things. Acupuncture has good data for osteoarthritis and musculoskeletal type pain in general. So you really need to push the provider that's offering these services and ask them, like, have you ever treated a patient like me? What were their outcomes? What did you see? Like, is this even evidence-based? So I think realizing what your goal is, and then questioning the provider in terms of their experience and what the efficacy is of the treatment that you're going for would be super helpful.
That actually just made me think of a really relevant question to a lot of people I've connected with and people listening. So you spoke to questions to ask your practitioner. And as someone who, when I was diagnosed at a young age, so I was 12 when I was first diagnosed, right around the cusp of 13, really fun time to have a curveball thrown at you. But I was in a system, like I went to a very large hospital. They do incredible things there. I think that it is an incredible organization, and I'm very thankful for the physician who I had. That said, it was very much you have 15 minutes with the doctor, get in, get out, you do your labs in advance, they look at your chart. This is in the 90s, so they literally looked at my chart and spoke with me. And so there wasn't this environment, and I was raised by parents or baby boomers. You don't question anything. And while I never advocate disrespecting or not making space to listen to the expertise of the physicians you're working with or anyone on the medical staff. I've worked with many incredible nurse practitioners, nurses, et cetera. So I always want to be respectful of their expertise and their time that they've spent studying it. That said, I think something that's lacking and something I myself had to learn over a long period of time, which involved some self-awareness and work on myself with therapy to not be such a people pleaser. I'm sure other women out there can relate to this. But to learn to have my own back in those medical settings, which can be intimidating, and to learn to do that in a way that's productive. So learning to advocate for myself, learning to ask about the medications that they're proposing I take, learning to ask about the side effects of them. Obviously, that also involves on the back end being a project manager of my own holistic health picture, because I have multiple autoimmune conditions. I have a bit of a complicated situation, which I know many people can relate to. But just basically, I guess it's a long-winded way of asking, do you have any advice or any questions even that you would advise patients who are going through either trying to find a diagnosis because they have that fun list of mystery symptoms, which a lot of us started out with, that they can't figure out quite what it is. And in my case, and in the case of many people I know and friends and family, that ended up being some sort of autoimmune condition. What can they ask, or what should they ask, or what should they be advocating for in those settings?
I think that's a really great question. Me included, I think at the beginning of my journey, I was a little bit timid to ask the rheumatologist any questions outside of what can I expect with the traditional questions, I think it comes down to how you're asking it, right? You're not going into defense mode being like, well, I'm not going to do what you tell me to. I think a lot of it is in how you communicate. And that is a skill across the board that most of us have to gain at some point in our lives, whether it's personal or work related. So you could preface it by saying, I'm doing all these medications, and thank you so much for educating me on these. I was doing a little bit of reading on my own, and I want to see what you think about X, Y, and Z. Like, what is your experience with this? Would you recommend this? Like, do you think it's worth it? And I would just leave it more open-ended rather than like, hey, I'm going to try this. What do you think about it? I would ask it more in the terms of, tell me what you think. Tell me what your expert opinion is on this. I don't think if it's done in an appropriate way, I don't think it should be an awkward setting, or it shouldn't like push down your confidence. You are the CEO of your care. That's what I always say. Yes, the doctor is here to guide you. They give you the tools. They're diagnosing you. They're helping you, but they don't know what your everyday looks like, right? So always remember that in the back of your head. The questions you're asking are for you because you're the one that lives with this. And so in order for you to be proactive, part of it is just learning how to ask a question in a tactful way.
No, thank you. That's extremely helpful. Something I know that if I had that information 20 years ago, I would have approached these conversations quite a bit differently. So along those lines of kind of the shift in the approach and asking questions, and there's physicians like you who are actually providing a more holistic lifestyle approach in conjunction with having the education and the Western medicine available to you that can really help these patients. Have you noticed or have you learned about treatments that if you had a patient come to you with, say, chronic pain, because I'm assuming that's something you deal with often, especially from a rheumatological specialty, would you, if you had a patient coming in, and I will make sure that I disclose here, I am not suggesting this is the prescriptive instructions you would give to any patients. Just hypothetically, if I came to you and said, I'm experiencing chronic pain, obviously we would go through something to determine if there's a medication that would be helpful if I had an underlying condition. But are there other things, I'm just using chronic pain as an example, are there other things you would recommend that are not really, at least in the standard of care, are not common to be told to you in your standard 15-minute check-in with a physician?
I think chronic pain is a perfect example of where integrative medicine really, really helps, because a lot of times chronic pain comes with your autoimmune disease. And a lot of times my job is to make sure it's not, you don't have a primary autoimmune disease and chronic pain is secondary from that. But either way, and that's where experience and data comes in. I deal with kids with chronic pain as well. So the adult world is a little bit different than ours. In my world, the best prognosis goes to the kids that work hard, and I'll explain what that means in a second. They work hard to undo their chronic pain, but they actually don't end up leaving on medications. And people are like, you're not giving medications for pain. And it's because when I explain the pathology of chronic pain and how it is due to like this abnormal neurocircuit that's short circuiting and just firing, you can't throw any amount of medication at a neural circuit. Like I've seen kids come in with morphine pumps, baclofen pumps. They don't hit that type of pain. So the first step is to educate them on what it is. And the second step is, okay, how are we going to undo this circuit? How are we going to reset it? A lot of the crux of therapy is actually counterintuitive. So it's desensitization. So the areas that are hurting, we go through a lot of, I'm not sitting here being like, hey, take these medications and come see me in 3 months. No, I show you with different tools on how to desensitize and how often and how frequently you have to do that. And then I'll also do physical therapy. I have a physical therapist here who helps with the graded exercises for certain patients to really help them push through the pain in small doses, right? To help reset that circuit. And a lot of it is finding out what your underlying triggers are. And so that's where psychology and counseling comes in, which opens up a whole new world of integrative therapies in like art therapy, journaling. We do breath work, meditation. There's so many different things you can do, so many different cool apps out there as well that help people do guided imagery at night. And these aren't magic cures for chronic pain. These are when you do these in small doses every day for months, it adds up. And you start to feel better because, and that's my job, is explaining that, hey, there's not a one-shot medication that's going to fix everything. I wish, right? But this is going to be, I'm your cheerleader and you're actually the one doing all the work. So the conversation changes into more lifestyle type topics on like, okay, I help them craft kind of a day-to-day schedule of what their day should look like. Because a lot of these kids are homebound. They're not going to school because they're in so much pain. So we bring in a lot of when I say Eastern modalities, it's also an Eastern mindset of like routine and consistency and gratitude and journaling and all those things that when we have such a fast-paced life, it's easy to miss those things and forget how that adds to your overall symptoms.
No, that's incredible. It took me just saying this as for the patient hat on. It's something that when I was diagnosed back in the 90s, that stuff was still considered quite fringe, at least in the Western medical world. And it was just so refreshing to me to, even before I got into actual meditation, just having Shavasana at the end of a yoga class that I went to purely for exercise. I was like, what is this feeling? I've never had this feeling where I can just disconnect for 5 minutes and just come out of that class feeling like a new person. And for someone who's dealt with chronic illness the large majority of my life, that was a pretty major light bulb moment. So the fact that it's being incorporated in your practice, I think, is wonderful. A question I have, since it kind of boggles the mind a little bit that you went into rheumatology when you did not have a rheumatologic condition, and then you ended up being diagnosed with one later. And I'm guessing you didn't even have symptoms at that point either,
it was
correct?
like maybe a few months after being done with fellowship, and I had just had a baby. So I was like, it's obviously because I'm stressed and I just had a baby. My body's going through changes. I just chalked it up to a bunch of other stuff.
So do you feel, I'd love to hear first a little bit about your journey, because one thing I know was difficult for me when I was younger, and I'm sure was a pretty hefty stress around my parents because I was quite young, was finding a diagnosis. It is that weird feeling of you don't want to be told you have a disease, but there's also this huge relief when you know what is going on. So I'd love to hear a little more detail about your journey or whatever you're comfortable sharing. And then a follow-up question to that was, since you've been through that journey and since you have one of these conditions, even though you're treating pediatric patients, what benefit and value do you feel like that adds to your abilities as their physician?
No, those are great questions. My journey was I came out of fellowship, started having some pain in my fingers, stiffness. Again, didn't think it was anything big, right? And then this went on for about 6 or 7 months. And I was like, I should probably go to a doctor at this point, right? I saw my primary care doctor who was like, I think you have arthritis. I was like, okay, if you say so, like, how could I miss this? I'm a rheumatologist, right? So I go, I'm a good patient at this point. I go to the rheumatologist and she just looked at me in the eyes and she was like, you have rheumatoid arthritis. And I think there were like so many thoughts going through my head at that time of mostly of denial. And I think maybe deep down I knew this is what was going to happen, or this could be a possibility. But I also knew the flip side of what that involved, right? The doctor's appointments, the labs, the medications, the whole thing. So part of me, I think, was in denial of the diagnosis walking in. Even day one, I was like, maybe she's wrong. Maybe, you're hoping they're wrong, that this is going to pan out to be something different. And then time kind of settles that, right? You kind of cope with the fact that you do have this. And then it's more of, you put a different hat on of like, all right, this is a diagnosis. How are we going to attack this? In my mind, being like a type A person who's had a plan, you set your mind to something, you do the task, and then you get this outcome, right? In my head, I had magical thinking a little bit, even as a doctor. I was like, I'm going to take the meds and this is going to be like in the background. No big deal, right? No, I've struggled with this disease. My first 6 years, I failed 8 different medications to put my disease into remission. And I at one point I was like, maybe this is the wrong diagnosis. I have no idea what's up and down anymore. I just can't orient myself at all. And finally, over time, I found the right combination of medications. I accepted the fact I had this. I became less reactive. Like I understood what my triggers were in coping with this disease, and kind of how to navigate the process of the bad days as well. And being gentle with myself. Like I don't always have to be 100% every single day. It's okay to say no to things. Little things like that. It doesn't happen overnight. You are forced to kind of go in that direction and learn to be okay with that. So that was kind of my journey. Now, the ups and downs of that journey were it sucked to have to go through, but being the doctor who's experienced that, who puts her patient through that probably as well, has been so incredibly eye-opening. Because when someone comes to me and they're like, you don't know, if they don't know that I have this diagnosis, they're like, you have no idea. You don't know what it's like to be on methotrexate. I do. I do know what it's like to be on methotrexate. I totally understand where you're coming from. Or the flip side, sometimes because people see that I'm holistic and like the lifestyle stuff, they're like, well, we've tried everything and we only want to do homeopathy. You get that, right? And so I'm like, I do understand that. And I share the same fears as you for being on these medications, but you have to view it as like benefit risk, like what would happen if we didn't treat appropriately. So I think coming from me, who's gone through that, it holds a little bit more weight than just your regular doctor talking kind of down to you. Cause I felt that as well.
No, absolutely. I take medication. I've had guests on here, Lily Stairs, who we've been connected through from the Chronic Boss Collective. Yeah. She shared with me the same thing. She's like, I take medication. I have no shame around it. I'm the same way. I have to take medication for Hashimoto's. Yeah. I definitely went through a stage where I decided, similar to those patients or patients' families you're referring to, where I was like, I don't need medication. Yeah. I can do this on my own. Now, to be clear, certain diet changes, I have to be mindful of any extremes I go to. I had a disordered eating issue when I was in college. And as many women go through some level of a disordered eating pattern or just a poor relationship with food, because if you grow up in our society, kudos if you don't. Yeah, exactly. So I try to make sure I'm not going full black and white. Like the autoimmune protocol, for example, did not work for me. It was far too restrictive and it put me into a bit of a tailspin with anything like holiday dinner or things that are typically very enjoyable. So I know that's helped many people, but all that to say, I've gone to that extreme where I'm like, I don't need medicine and stopped taking my thyroid medication. And immediately, and I'm not noting this for a body issue, but immediately gained 10 pounds, like immediately within weeks. And I went to get my labs done. Shocker, my TSH was off the charts. And I'm of the belief that you should be testing for the full thyroid panel because I want to see the antibodies and the T4 and everything else. So all of those were not looking great. And my doctor had to have a very frank conversation with me. And she also was open to the lifestyle changes and the holistic approach. And she's like, I understand the frustration, but you are hurting yourself. You need to take this medication. Yeah. And if there's a way that we can start seeing if we can reduce it, if your labs are staying normal, we can go there. But just going off of this is very, very unsafe. And for anyone that's not very familiar with the thyroid, it is the master gland of your endocrine system. So when you're not monitoring that properly, when you have an issue, it is going to cause a domino effect with all sorts of other issues in the body. So I think a lot of the messaging out there that the best way to summarize it, it almost just kind of projects shame on you for not figuring out a way to do it without meds is really problematic. Yeah. So you're left in this really precarious situation as the patient, because on one side, you should be able to advocate for yourself in a physician's office. You should be able to ask questions. When immunosuppression is brought up, you have to be able to say, okay, what are the side effects here? Yeah. What is the risk that I'm taking? What's the reward? And sometimes you are, at least in my case, you have to take something that you might not love at a particular moment if you have a flare-up, or you're not completely comfortable with, but that's where you have to find a physician you're working with where you have that trust and that relationship built over time. Trying to remember where I was going with this whole topic, but it feels so great to connect with someone in the rheumatology space since that's where I started. But I feel like the patients are really left in kind of that, I want to try the Eastern approaches, but those schools of thought, people in that space that are kind of zealots in that space, tend to kind of condemn Western medicine. And then you have, at least in my experience, when I was diagnosed, I had physicians who were much older, not particularly open to exploring the other facets affecting chronic illness. And so you've got two adversaries locking horns and you're stuck.
And you're kind of confused too, right? Like you don't know what you should be feeling. You're like, should I only go this route? Should I even attempt this? Will this work for that person? Why not try this? And it's a very confusing journey. It's so confusing, which is why it's important to be discerning, because not only discerning, but also open-minded in that, one second, but also open-minded in that maybe the reality is you do have to be on this annoying medication for the rest of your life, but that doesn't make you any less. It doesn't make you any weaker. It doesn't make you anything less than other people. So it is almost a form of acceptance therapy to move forward and say like, all right, cool. So I'm just going to gear up to the fact that I might have to be on this forever, but maybe I should be optimizing other things as well, because no one told me that, people with autoimmune disease have a higher risk of heart disease later down the line. Like I learned that stuff kind of through reading and learning. And then another valuable thing that I got through my integrative medicine fellowship was motivational interviewing skill. So when I ask patients, especially kids, like, why is it even important for you to be healthy? Like, why are we here together? Why are we talking about this? They're like, well, I want to be healthy. It's like, well, why? If you don't understand your why, other than someone told me I need to be healthy, it's hard to motivate people to do something, even take their medicines. Like, teenagers fall off the compliance train a little bit once they're like that 13, 14 age. And you kind of have to have that conversation of like, wait a second. I think now that you're older, it's important to have this conversation of like, this is your reality. This is not something that mommy tells you to take every day and then you do it and then it's going to stop once you go to college. Like, we're going to have to figure this out. And so when kids get to that age, and even adults, when they come in, sometimes it's like, what is your motivation? Like, why are we here? Why do you want to get better? And so it's important to kind of have context for everything.
No, that's wonderful too that you're speaking to that teenage phase, because I know, at least for myself, when I started having issues that issues that became exacerbated by major life shifts when you are still in that age range. You don't have a fully formed brain at that point. You're wanting to rebel. I was you can relate, I'm sure, straight A, very diligent student. I thought, college is my time to shine, but I also was very excited to not be under my parents' thumb, and definitely partied way too hard and struggled at the outset of college, and then started developing symptoms for Hashimoto's, which took an additional, I'm trying to do the math, 6 years from when I started college to be diagnosed with. So it's really interesting when you talk about having those motivational discussions, because that's something I think a lot of us in the transition from adolescence to adulthood did not have. And so you're left without the tools to really understand why you're doing what you're doing, or what your goals are behind what you're doing. So do you have any advice for someone listening that is no longer a teenager, but didn't have that type of guidance, and they're dealing with chronic illness? What might you tell someone that's in their 20s, or even in my case, I didn't really start looking at this in a different way until I was in my 30s. What might you tell them that would be helpful for an adult mind to hear?
I think at any age, seeking your motivation or figuring out your why is important. And it's also important to note that sometimes that changes throughout your different seasons of your life, right? Health, vanity, whatever, grandkids, everyone has different reasons to be healthy. So that's number one, is it's never too late. And even if you missed it in your teenage years, it's never too late to start thinking about it now. Now, one thing I would always say is that it's okay not to know all the answers. I think when you're going into a chronic illness, you want to know what the prognosis, you want to know all the facts, right? Like, what can I expect? What's my life going to look like? But the reality is sometimes that's just, most of the time, I would say that is not possible. Like, I can't predict. I don't have a crystal ball, is what I always say. I wish I did, but this is what I know. And you have to interpret that in the context of your life, right? So for me, for someone who had to be on call all the time in the hospital overnight, I would be on steroids the week after being on call, because that's when I realized stress and lack of sleep really trigger my flares. And no one told me that. I didn't know that at the beginning, but that journey it changes. And so my motivation shifts, right? And we're like, now I got to get sleep because I don't want to feel like X, Y, and Z the next day. So you just have to figure out what your triggers are, that's where the lifestyle stuff comes in. No one's going to answer that for you other than you. What are the foods that you're eating that make you feel great, that don't make you feel good? And there might not be a great answer to that. And that's okay. That's good. That's fine. Or sleep, like, is lack of sleep triggering anything for you? When you travel, do you get stressed? Like, are you packing all these things when you travel? Are you thinking ahead in terms of things that could go wrong when you're traveling? So that's a lot of the education I do. I didn't learn any of that in my rheumatology fellowship. I learned that in the life, just being a patient.
Experience-based expertise.
Just being like, these are the things you think about.
Yeah, that's wonderful advice. It also just made me think of something that happened to me recently. I've done the Strengths Finder. I think now it's called Clifton Strengths, but it was called Strengths Finder for years. Anyone else who's in corporate, they make you take that a lot if you are joining a new team and they want to understand everyone's strengths and how they work together. So one thing I would add to that is, if you do this reflection and time has gone by, don't think because your triggers might not change as much, but don't think your why is always going to be the same. So the example I put out there, just as someone who was super success driven without really understanding what I considered success, it was what everyone else convinced me success was, whether it was directly told to me or just absorbed around me from what I was exposed to growing up. Sometimes you have to really look at your why. Like, if you're listening to this conversation and it's resonating, and kind of strip away everything that you're concerned other people are going to think, and think of like, okay, what do I actually care about? Like, what is actually true for me? And the reason I brought up the Strengths Finder, I've taken that thing so many times, and I had to take it recently. And I just had this moment beforehand where I was like, I'm just going to be super honest for this, because I usually, without even realizing, it wasn't conscious, I was answering it for the person I saw myself being. And I'm not talking about, you talk about your future self when you're in line with what you want and what your passion is. But I'm talking about like what I had painted for me growing up, of like, this is success. And I was like locked in on that. And so I was answering for her. She doesn't exist. She's not me. And what I'm passionate about and what I want is totally valid and wonderful and just different from that. So I just wanted to add a layer to what you said, because it's something that came up for me recently. Like, don't think because you thought something 5 years ago or even 6 months ago that that's truly your why. If you're starting to get that itch that like, maybe I want to be healthy for a different reason, or maybe I want my goals to shift, because it was quite interesting to see the different strengths that came back, where I was like, yeah, that's more in line.
I love that you say that, because I think we're not taught to reflect like that. We're taught to just have this imaginary vision of who we are with your work life, with your personal life. And it's just, sometimes you don't take a moment to reflect and say, is that really who I am? Is that really who I want to be? And that doesn't get answered overnight. Sometimes that takes months, sometimes years to answer. But if you're constantly thinking along those lines, I think it's hard to go wrong, because you're showing up for your true self, what you really want to do in life, what you really want to be, who you want to serve, like what fulfills you. I think that's where the work is in life in general, but doubly important when you have a chronic illness, because you have to realize you're going to make a lot of people angry when you make those decisions. Like, maybe you don't want to work at a certain place anymore, or you don't want to go visit this person, or you don't want to do New Year's Eve because you're tired and you need sleep. You're showing up for yourself. Yeah.
So I know personally, it was hard for me. I still work full-time in fintech, and I enjoy my team and the company I work for. But this is something I'm super passionate about. It's something that requires me to be a lot more vulnerable. And one of the reasons I hesitated to start a podcast for a long time was, oh God, what if one of my colleagues hears me share about these things and it's revealing like a chink in the armor? And I work in a very hustle environment, and it's just, I work in tech and things change constantly, and you have to keep up and you have to be on. And to share openly, like, I have these health issues that have caused serious problems for me over my life and still impact my day-to-day life. To me, it's normal because I've dealt with this for almost 30 years. But it's my normal that I think if a person that doesn't have chronic illness stepped in and had the experiences I have on a day-to-day, they'd be like, "Ooh, what's going on here?" Because you just adjust.
I don't think you should have to pretend that you go home, you're this one person, and you go to work and you magically don't have your issues anymore, right? Like, it's important. If people don't realize that on who you work with, I don't know if that's really, like, those are the right people for you, at least. And sometimes it's realistic for you to leave that setting. Sometimes it's not. But I think in your mind and in your heart, you need to know that, like, the people who show up for you, they show up for you in your work life and your personal life. They don't discern between this version of you and that version of you. In my eyes, it's just you.
Yeah. And not to say this would be true across the board. I have friends in investment banking who would laugh in my face if I said this, but I was very pleasantly surprised. When I shared it at work, I had people sending me messages on Slack, which is our, for those who aren't familiar, just a way to message and have group channels to cover tasks at work pretty efficiently. They were pinging me on there, just being like, "Oh my God, this is great!" And it was just like, "God, what was I
and so worried about?" Funny. It's like you live your life based on what you think other people think of you, which is mind-boggling. It's not even fact. It's a feeling. And so, and actually, it's an important point to point out, because that's why I bring up expressive journaling and just like brain dumping at night, because a lot of times the things that sit up here, or this feeling or emotion, when you start to write it in a full sentence, it crystallizes a little bit better, and you're putting more critical thought into it rather than it being an emotional feeling taking up all this space. So it's funny. It's like, well, why do I feel like that? Do I actually know this person thinks that about me? And the answer is usually no. It's what you assume in your own head, and that's what's leading you.
Yeah. The next step, which is much harder, is if they don't like you or aren't into hearing it, it's okay. Right. Not everyone has to be into it. That's like the next level up that I still work on, because I'm like, why don't they like me?
I know.
And you realize it's not personal.
Exactly. It's not personal.
Yeah. But like, what you have to put out there is going to resonate with someone.
Yeah.
And my hope in this podcast, and I do have one more question for you, but my hope in this podcast is that someone listening that feels like no one's going to want to hear this, I don't want to reveal what might be perceived in our society as weakness. Yeah. That's not true. And there are countless people, especially women, who can relate to that particular situation. So I wanted to ask you a little more. You talked about it a bit when we first got started, but what do you feel, since you're talking about your why, what was your why and your big motivator to like take that final leap? Because I know how prestigious Texas Children's is, specifically their rheumatology department even. Was that a hard thing? I'm going to assume yes.
Oh my gosh, yes.
But to step away from, and what got you to that point that you were like, this is not the exact environment for which I am meant to be to do my work?
You know, that's a great question. That is a very, very good question. I think I trained there. I stayed on as faculty there. The people there are family. I'm still very close to them. I think it got to a point where it's like, it wasn't the people, it was more like, I can't practice medicine in this setting where I really don't feel like I'm helping people navigate this process. I'm kind of living in a silo and fixing their symptoms. And I'm really good at that, but I don't think I'm addressing what's happening outside of here. And that once that feeling started to seed, it just grew. It just grew and grew. And it got to a point where I was like, I'm either going to be here forever and die at this institution, or I'm going to try something different. And I think I left like shortly after COVID happened. So there were already some changes happening. And so I was in the spirit of change, I think. And it took me 2 years to finally pull the trigger and be like, all right, we're going to do this. And even after I left, it took me 9 months to figure out exactly what it is that I wanted to do. And for me to take that time off, it was so incredibly important, because you really, without all the noise kind of goes away when it's just you at home, right? And then again, I did journaling of being like, what is it that I'm looking for? What are my goals? What's my values? What's my mission in doing this? And so I gave myself a little bit of time, even though it was incredibly uncomfortable to make that decision, right? To figure out where it is that I'm going. And once I kind of made that vision a little bit more clear, then it was easier for me to take steps towards that, right? Until I got to that point, it was just a feeling that sat on my heart, and I didn't know what to do with it other than just kind of try to process it.
No, that's extremely inspiring. And I again, me asking that question is in no way to say anything negative about that particular institution, but I just think it's so inspiring for people if they realize they're in this great place and a place that's doing immense good, but it's just not where they can flourish with what they're called
Right.
to. And I really think it's inspiring and brave of you to recognize that and actually take the step and do that.
Oh, it was. And now sometimes I think back, I'm like, if I knew what I knew, the steps to trying to go through this, I probably would have second guessed myself. But I think ignorance was bliss on that front. But you really have to listen to your true inner self. And I know it sounds cheesy. I know it sounds like, yeah, I've heard that before. But how often are you doing that on a day-to-day basis? Like with the things that you choose, places to go, people you hang around with. I mean, I think the people, what do they say? The 5 people, you're the average of the 5 people around you, including the people you work with, including your MAs, including your secretaries, including, so it's like, are you in the right environment where you feel like you're flourishing the most you want to flourish? Right. And if there's a part of you that's not fulfilled, you gotta dig deep and figure out what it is that you don't like.
Yeah. And similar to doing the self-reflection on your why, you got to kind of block out what other people are going to say, especially the people that are going to say something negative. They're allowed to have their opinion.
Yeah.
And it just isn't yours. But thank you so much. I think this will be an incredibly beneficial listen for anyone who's going through the experience of getting diagnosed or has kind of struggled in that difficult middle ground we talked about between the holistic, often incorporating Eastern healing modalities and the Western, the hyper-Western, I'll call it, because there are obviously very great physicians within the Western space. But I thank you for what you do. I just felt very called to reach out to you to be on the podcast, given our links with where I first received a diagnosis and went. And the one thing I wanted to ask is if anyone's listening who say it's a parent who has a child with the condition or someone who experiences a rheumatologic condition themselves, where could they find you?
Sure. Yes. So first of all, thank you for having me. It's been a pleasure talking, and I wish I had this recording when I was first diagnosed, to be like, hey, it's going to be okay. Where can people find me? So a couple places. So I'm on social media at Room to Grow TX. So RHEUM and then TO Grow TX. And my website. I
love the play on words, by the way.
And my website is roomtogrowtx.com. And you can fill out a little, if you're interested in talking to me, there's like a discovery call you can do to see if I can help you, or just call my office and my nurse should be able to help as well.
Thank you so much. I really appreciate you taking the time today to be on the podcast. And I'm sure I might ask you to be back on again sometime in the future.
Oh, of course. I'm happy to. Thank you. Thank you.
I really hope you enjoyed this episode of Invisibly Unwell. If you like the show, I'd greatly appreciate if you followed it. And if you left a review on Apple Podcasts, Spotify, or wherever it is that you're listening. This allows me to keep the show going and to continue to bring on incredible guests to share their stories.